Welcome to the Medicare Moments Show. I'm Katherine Watson, and I'm going to be your host today. And of course, we're going to be talking with Toni King. She is the Medicare expert. Toni has been helping people for, about 25 years or more with their Medicare issues and confusion and solutions. And I know a lot of you out there are like me. You've been really confused about Medicare. It seems the rules change constantly and you're not really sure which plan to go on. Everybody's situation is different, and Toni has worked with so many different situations. She has several ways that she can help you. Of course, she's a consultant and can sit down with you one-on-one if that's what you need. But she also has written the Medicare Survival Guide. It's a book that will walk you through everything step by step. And her Medicare column is syndicated in over hundreds of newspapers across the country. So there's lots of different ways to get information. Toni puts on webinars from time to time, and also workshops right here in the Houston area. But now she's got a new solution. She's moving into the digital age, and she has created the American Baby Boomer Society. And I'm really excited about this because it's going to be a way for everybody to get the information that they need when they need it. I don't know about you, but I know I like to do my own research. I don't want anybody breathing over my shoulder and trying to steer me in a certain way or trying to sell me their product. I want to do my research and then go and talk to an agent. So now you can do that. Toni started this because she heard story after story after story of people who were getting the wrong information from either misinformed Medicare agents or somebody who was just trying to sell them a product. And sometimes even the Social Security office was giving them incorrect information. And it literally cost some of these people thousands of dollars. And Toni thought there's got to be a better way to make sure that everybody can get this information. So the American Baby Boomer Society was born. And you can find it by going to abbs4u.com. And the website is set up with easy to use modules with videos that walk you through every situation step by step. It's like Toni is right there holding your hand, walking you through the program. So this is a great resource for anybody that's getting ready to get on Medicare. Once you're armed with the correct information and you know what you need, then you can sit down with an agent and choose the plan that fits those needs. So take a look at the American Baby Boomer Society, and that's abbs4u.com. And right now, you can join the American Baby Boomer Society for a super, super low price of only $9.95. That price is going to go up, though, so don't delay. Go ahead and join today and start getting the information and relieve some of that stress that you've been feeling. Now, without further ado, I'm going to go ahead and bring Toni on because she has some information to share with you today that I think you'll find quite helpful. Hi, Toni. How are you?
How are you doing?
I'm doing great. It's a nice Friday. We've got good weather here in Houston. I don't know about the rest of the country, but we're blessed here.
Yeah, we don't have the rain. We're doing well.
Yeah,
we need to let them know you and I are in the same city. So
yes.
that's how we met. Was
that's right.
through when I was doing workshops on Medicare. That's where you and I
Exactly.
started bonding.
That's right. That's right.
And you like to help people, and I like to help people.
We both had a passion for helping folks as they age to get the right information. That's important to both of us. So I'm glad you're here. I'm glad we connected, and I'm glad we stayed connected. And I'm glad to be doing the show with you. It's really great because you've got some great information. I know a lot of my friends, and I've sent you several of them lately, because they've been confused. They're reaching the age. I'm a few years out, but I'm getting close.
When you're turning 65, or when you're somehow, I don't know how they get your name and your number, but they can find you. And people start getting bombarded with telephone calls, and people are scaring them into what they need to do for their Medicare. And a lot of people don't even need to enroll yet. And they are getting the wrong information from telemarketers, and they don't realize that telemarketers are there only to make money. That's why they're marketing. So today we're talking about how to enroll when you're turning 65, or what do you need to do? Okay, and that was the article that you posted on Facebook for me, because you helped me with all of my Facebook. And that's what we're talking about today, right?
See, exactly. So Toni, walk us through the steps. If I'm getting ready to turn 65 in a few months, what do I need to know?
Well, the article that we're talking about that's in the newspaper, and if anybody wants these articles, we do have them on the website. We have them on the Toni Says website, and they're also in various newspapers throughout the United States. But this article is about someone who's turning 65, and she decided to enroll in Part A, but delayed her Part B because she has company insurance. And now she wants to quit her job, but she's already delayed her Part B, so she doesn't really know what to do. And so we sat down and worked out a whole system for people, and they need to understand you've got a certain time to enroll in Medicare. And it's called your initial enrollment period. And it starts 3 months before you turn 65, where you can enroll. You can get Part A, you can get Part B, but the buzzwords is still working. If you're working full time with true company insurance, be careful, because you may not want to enroll in Part A and Part B. Don't let your friends or the telemarketers scare you. And then you've got your month that you're turning 65 that you can enroll, and then they give you 3 months after that you can enroll in Medicare. And people don't understand how that 3 months works, and that can really confuse you. So my advice to Gail, who was thinking about enrolling in Part A and delaying her Part B, I said, we got to find out what you want to do. And so we put a whole system together for it. And is there any question? I mean, do you want me just to explain what you need to do or how it goes?
Please do. Walk us through it, because I think this is something that affects a lot of people, because a lot of us are working longer, and may still be working at 65, or be getting ready to leave the workforce sometime shortly thereafter.
Right. And what I suggested to Gail is for her not to delay. Well, she was going to delay her Part B and start it like a month or two after she turned 65. And I said, if I were you, I would not do anything. Because the way it works, you can enroll 3 months before you turn 65, and it starts on the month that you turn 65, the first day. Mm-hmm. So if your birthday is in June, then you can enroll 3 months prior, which is May, April, February. I always have to think back. So it's March, April, May. You can enroll 3 months before, and your Medicare will start June 1st. If you enroll in June, then it starts the month after that. And then it starts getting kind of swampy after that time. And if she enrolls in July, which is 1 month after June, her Medicare won't start for 60 days.
Why is that, Toni?
That's called the Medicare. This is part of the Medicare effective date schedule. So you can't think if I enroll in July, it's going to start August. No, it starts 60 days later. So hers would be August, September. Hers would not start until October 1st. You got to go through those 60 days. And then if she enrolls in July, August, if she rolls in September, it starts 90 days later, which is she rolls in September, that's October, November, December. So her Medicare would not start until January 1st. And then if she enrolls, so June, we got July, August, and September. So if she enrolls in September, it starts another 90 days later. That's October, November, December. It starts January 1st. It gets confusing.
Yeah,
so
it does.
my advice to her was to not worry about enrolling. Don't delay her Medicare Part A and B. But if she's thinking about enrolling 3 to 6 months after, she's turning 65, to go through that 90-day window. So we got June, July, August, September. Okay? Wait until after September and enroll, and her Medicare would start October 1st because she's past her initial enrollment period. You wait until the whole 6 months are gone. She's got company insurance. She can go down and enroll with the company insurance. She was working for a very large company in Houston. She continues to work. But if she enrolls, we got July, August. If she enrolled in September, then she's got 90 days to wait. That's October, November, December. Her Medicare wouldn't start until January 1st. But if she enrolls in October, which is past that 6-month window, her Medicare would start the next month, which is November. Don't ask me. That's how she's past.
No wonder everybody is confused.
Window. Yeah.
No wonder everybody is confused and stressed out. That's complicated.
So why can't they make it the same? You think it would be the next month, but it's not.
And this is really important because if she's going to let go of her health insurance with her company, she's got to coordinate that so she doesn't have a gap there, because if you could have a gap there and it could be a huge problem for you if you have a health issue.
Or you may get on COBRA, and COBRA is continuation of coverage, but they want you to be on Medicare with COBRA. And if there's no Medicare there, then who's going to pay? We don't know. So when we do a consultation, whether it's online, I do it through a webinar, or whether someone comes in the office, we show them, you got to have the Medicare effective date schedule in front of you. So I told Gail to wait until her 90 days is up past June, July, August, September, and then enroll if she's leaving her work. Because you can't go down to Social Security. They look at that Medicare effective date schedule. They're not going to automatically give her Part A and her Part B. She's going to have to wait until those times go away, until it's kind of it's really enrolling. You've got to do it the right way. People don't understand. If you have true company insurance, that's the best that you can get. They think that when they get that little form from their company that says credible coverage, your friend that you sent us to, who's retired from a very large company, has a credible coverage letter. That is telling her that her prescription drugs is as good as what Medicare has. It's not saying she has good insurance as far as health benefits, and people confuse it. So it's telling her that she doesn't have to get a Part D plan because she has credible coverage. And she was confused. She says, "Is that all that is?" I said, "Yes, ma'am, that is it." So we took care of her. We made sure that her husband, she had already gone and enrolled him in Medicare. We made sure he was totally taken care of with his benefits and everything. It's mind-boggling. It
It
brings,
is. It
yeah.
really is. It really is. And I'm starting to see a lot of my friends are hitting that age, and I'll be hitting that age soon. And even though I've listened to you a lot, it's still it's
It's
hard to
daunting.
wrap my mind around sometimes.
And the
Um,
smarter you get, the more it confuses
and
everyone.
and it changes, doesn't it? They have
Uh,
changes,
well, they all think
almost
the
every
donut
year.
hole is going away. They all think the donut hole is leaving.
It's not.
No, it'll never
Oh,
go away. You still
that's
have the donut. It's not going away.
okay.
You
Yeah,
you
I
you
had
don't have
heard
to
it
pay
once.
100. Yeah, I know.
Yeah,
Rumors, that's a
rumors.
lot that
Yeah.
they say. You're still going to have to pay 25% of whatever the cost of that drug is when you get in the donut hole for
Hmm.
what we know right now. Now they may change things for next year,
Hmm.
but it's the prescription. Well, that's another subject that we get.
That's
Another
a
subject.
whole nother subject. Yeah. So the main thing is right now is knowing when you should be signing up. Now, what if somebody is not working, or say they're self-employed, Toni? How does this change as far as your sign up dates?
I'm self-employed, and I know you're self-employed.
Hmm.
I mean, I don't have good company insurance. I don't have a husband that's working for a company where I can lean on his insurance. When
Right.
I turn 65, I'm going to take that 90-day window prior, and I will enroll in Medicare. So my Medicare starts May 1st because my birthday is in May. And if anybody
Hmm.
wants to, you can send me birthday presents. I'll take them. May 1st is when I want mine started. And it'll start the first day of the month, even though my birthday is on May 20th. Okay.
So
So I will,
in order for your Medicare to start May 1st, which your birthday is in May, when do you have to sign up, Toni?
I can sign up anytime prior to that 90 days. I can
Okay.
sign up. I always have to count back. April, March, so February, March, or April, I can enroll, go online and enroll in Medicare. And we'll talk about how to do it online. That's a whole nother
That's
subject
a whole nother subject, and we're going to get to that.
to that.
Absolutely.
But I'm not working full time with True Company Insurance, so I will want to go online and enroll. So my Medicare starts May 1st, 90
Okay.
days prior.
Question.
What?
Okay. So you said in April you would have to sign up, by sometime in April. Anytime in April? Could it be April 29th and you're
It can
covered
be
May
April.
1st?
It can be 30 days past September, April, June, and it can be April 30th. There's only
Okay.
30 days
So it
in
could be
April, as long
30
as
days.
it's
Yeah.
prior to May 1st.
Okay. That's what I wanted to
Anytime
know.
within, and they count their days.
Okay.
But they now want you to go online and enroll. So you can enroll. If I enroll in May, then my Part A will start May 1st, but my Part B won't start until June 1st. If I enroll in June, because my birthday is in June, because I decide to enroll because my birthday's in May, that's the month after. You got a 60-day window, a 2-month window before it starts. So that's June. I enroll in June, you got July and August. That's 60
Hmm.
days. Mine would start September 1st. If I enroll in July, I have 90 days. So that's August, September, October. It would start November 1st.
Hmm.
And if I enroll in August, that's another 90 days. That's September, October, November. It would start December 1st.
Okay.
So don't wait. At that time, you have no
Yeah.
benefits.
Yeah.
Yeah.
Yeah. That doesn't make any sense.
You don't
Yeah.
get a penalty, but you're hanging out to dry.
I think it's a little bit less confusing for those of us that are self-employed that don't have great insurance through a company. I
Right.
think it's pretty cut and dry. I think the ones that are working for a large company and have those benefits and are looking at retirement dates and all of that, it's a little trickier for them. But I think this clears it up. I really appreciate you coming on today. If anybody has any questions, you can post them in the comments below, and we'll get Toni or somebody on her team to get back with you and get you the answers you
We're
need.
keeping the
Or,
team busy.
or you can go to abbs4u.com, sign up for $9.95. I mean, come on, guys, that's a no-brainer.
It's for a whole
Get
year.
all of the information that you need, all of the resources in an easy format with videos that walk you through step by step by step. So you can sit down at night with your spouse and go over everything together in the comfort of your own home without anybody trying to sell you anything. So
let me tell you something, Catherine. I have people who bring their Medicare survival guide in, the blue book that you have up there,
mm-hmm.
and they have highlighted and they try to study it and they highlight it. They're just worried to death. And let us take your worry. Don't worry about it. Okay?
Yeah, I like that.
We'll make sure that what is done is the right way. Okay?
All right,
and I
great.
appreciate you taking your time and getting the word out.
And Toni knows. So give her a call, sign up on abbs4u.com or connect with her in some way. Continue to listen to these live videos and podcasts so you can get all of the information on anything new with Medicare. Thanks so much. Have a great day. Bye, Toni.
Bye.